This session's focus is on how adults can intentionally facilitate learning while honoring the child's routines, relationships, and developmental readiness. Skill acquisition in early intervention is not about teaching isolated tasks. It's about helping children participate more fully in everyday life. That means that we want intervention targets to be meaningful, functional, and connected to what families do throughout the day. We can talk about foundational concepts and practical strategies, and then we will also think about assessment, planning, instruction, and progress monitoring because we need all four pieces to work together for effective intervention. We know that infants and toddlers learn differently than older children. They need repeated interactions, movements, sensory exploration, and responsive caregiving. Another idea is that skill acquisition happens best when adults are intentional without becoming overly directive or disconnected from a child's natural environment. I challenge you to think about how each strategy that is discussed could be used with families, teachers, anyone who supports children daily. Skill acquisition matters in early intervention because the goal is not only developmental growth, but also improved participation in daily life. When children gain meaningful skills, families often experience less stress and more confidence during routines that once felt difficult. For infants and toddlers, even a small new skill can create a major difference in communication, regulation, movement, or social connection. For example, a child learning to reach, gesture, imitate, or transition more smoothly can participate more successfully. Early intervention professionals, therefore, need to think beyond broad developmental labels and ask what specific behaviors will help the child function more effectively. This functional lens keeps intervention from becoming too abstract or disconnected from what families actually need support with. It also helps teams prioritize skills that can be practiced often because repeated opportunities are essential for young children to learn and retain new responses. Another reason skill acquisition matters is that it gives caregivers concrete ways to see progress, which definitely strengthens buy-in and partnership. When families can recognize growth in observable skills, intervention feels more useful, practical, and empowering rather than vague or overwhelming. In that way, teaching skills is both a child outcome and a relationship building process with the adults who support the child. These learning objectives organize this session into three major expectations, which are explain, apply, and evaluate. You will be able to explain what skill acquisition means within early intervention. This includes understanding how intervention targets connect to development, participation, routines, and family priorities. You should also be able to apply instructional strategies by choosing approaches that fit the child's age, current abilities, and natural environment. Application is important because you do need to understand theory and practice translating it into specific teaching decisions. You should also be able to evaluate progress by looking at whether a child is gaining a skill, using it across settings, and maintaining it over time. Evaluation also includes recognizing when a strategy is not working well and knowing how to revise supports instead of repeating an ineffective plan. It's important to think about knowledge to action because early intervention professionals need both conceptual understanding and practical judgment. Skill acquisition refers to the process of helping a child learn a new behavior or strengthen a skill that is just beginning to emerge. In early intervention, the process is intentional, which means adults are not simply hoping the child will learn through exposure alone. Instead, adults are arranging opportunities, providing support, responding to the child's attempts, and gradually fading help as the child's competence grows. A skill may be motor, communicative, social, cognitive, or adaptive, but it should always be described in measurable, observable terms. Observable language is important because it lets the team see whether the child is actually making progress rather than just relying on assumptions and impressions. Skill acquisition is also dynamic because learning rarely happens in a straight line. It often requires repeated support over time. For infants and toddlers, learning is highly relational. So the adult's responsiveness and timing are part of the teaching process. This is why early intervention does not teach teaching as separate from play and daily routines. When we understand skill acquisition in this way, intervention becomes more practical because we can embed teaching into what the child already experiences. This perspective helps us plan instruction that is developmentally appropriate, functional, and most importantly, sustainable for families. It's helpful to discuss in early intervention the difference between developmental skills and functional skills. Developmental skills are abilities that reflect growth in areas such as motor development, cognition, communication, and social interaction. Functional skills are the ways those abilities help the child participate successfully in real routines and relationships. For example, reaching is a developmental skill, but reaching for a cup during snack is a functional use of that skill. This distinction matters because teams sometimes write goals that sound developmental but do not clearly connect to daily life. When intervention targets are linked to function, the family can more easily practice them and recognize why they matter. That does not mean that developmental skills are unimportant because they often serve as the building blocks for participation. Instead, the best planning usually connects developmental foundations to meaningful, routine-based outcomes. We would always want to ask ourselves as professionals, what developmental ability is emerging and how can that ability improve participation for this child and family? That question helps turn broad developmental knowledge into instruction that is relevant, practical, and measurable. We know that infants and toddlers do not learn through long explanations, formal lessons, or any highly structured work. They learn through movement, exploration, sensory experience, imitation, and social interaction. Because of this, intervention should be designed around moments that are active and meaningful rather than overly verbal or abstract. Young children need repetition, but repetition should occur across natural routines instead of feeling mechanical or disconnected. For example, a child may have multiple chances to practice requesting, reaching, shifting attention, or transitioning during just an ordinary morning. Another important factor is regulation, because a child who is overwhelmed, tired, or dysregulated will have a decreased capacity to engage in learning. The adults must pay close attention to timing, pace, sensory load, and the child's signals during intervention activities. Attention span is also limited in very young children, so teaching works best when it's embedded in brief, frequent interactions. When we understand how infants and toddlers learn, we become less likely to expect a performance that is unrealistic for the child's developmental stage. This understanding can lead to more respectful, effective, and responsive intervention planning with children and families. As we know, early intervention strongly emphasizes routines because routines are where infants and toddlers actually live, learn, and participate. A routine offers built-in repetition, predictable structure, familiar people, and naturally occurring reasons for communication and action. These features make routines powerful contexts for teaching new skills without requiring families to create entirely separate lessons. For example, mealtime can support requesting, grasping, imitation, turn-taking, and sensory tolerance, all within one meaningful event. When we use routines well, intervention feels integrated into family life rather than added on top as if an extra burden. Routines also help with generalization because the child practices a skill in the same context where it is truly needed. There is more effective than teaching something that is disconnected and hoping the child will later transfer it to their daily life. It's important that we learn to analyze routines carefully and look for natural opportunities where the target skill can be supported. This approach keeps intervention practical and sustainable, especially when families are balancing so many demands. It also reinforces the idea that ordinary moments can become rich teaching moments when all the adults are intentional and observant. Family-centered practice is essential in early intervention because caregivers provide the majority of the child's learning opportunities. Interventionists and other specialists may visit periodically, but families are present throughout the routines where skills are actually used and strengthened. This means effective intervention requires partnership rather than a model where the professional, where the speech language pathologist, the developmental interventionist, or the OT performs all of the teaching. A family-centered approach begins with listening to what the family values, what routines matter most, and what concerns feel most urgent. We always have to remember to recognize family strengths and avoid any language that could make a family feel judged, blamed, or overwhelmed. When families feel respected and supported, they are more likely to try the strategies consistently and share honest feedback about what is or is not working. Their feedback helps continue the process towards better decisions so that intervention becomes grounded in their real family experience. We have to remember that family-centered practice is not just being nice to families. It directly improves intervention quality. It leads to more relevant goals, more practice opportunities, and greater carryover between visits. Ultimately, skill acquisition is stronger when the adults in the child's life feel capable, included, and empowered. Responsive interaction is the foundation for skill acquisition because children learn best when adults are attuned to their signals and ready to build on them. A responsive adult notices what the child is looking at, reaching for, avoiding, or trying to communicate, and then responds in ways that support that interaction. This approach creates engagement, and engagement is often the gateway to teaching. If an adult moves too quickly, gives too many directions, or ignores the child's cues, learning opportunities can be lost. Responsive interaction is especially important for infants and toddlers with delays or disabilities because their signals may be subtle, inconsistent, or easily misunderstood. When adults treat those small signals as meaningful, they increase the child's motivation to communicate and act again. This in turn creates a positive loop in which the child experiences success and the adult becomes more effective at supporting growth. We should all think of responsive interaction not as a separate warm-up activity, but as part of the instruction itself. It helps determine when to prompt, when to wait, when to simplify, and when to celebrate. Without responsiveness, even well-planned teaching strategies can feel mismatched and ineffective. Before choosing a target skill or teaching strategy, the interventionist needs a clear understanding of the child's current level. Observation helps answer practical questions about what the child can already do, what support is needed, and what seems to interfere with success or progress. This step is important because intervention can become inefficient if adults target skills that are too advanced, too vague, or not matched to the child's readiness. High quality observation includes looking at the child's engagement, regulation, communication attempts, movement, and responses to familiar adults. It also includes noticing what happens in different routines because the child may act differently at mealtime, playtime, or transition times. Family input strengthens observation by adding information about patterns that may not be visible during a single visit. When interventionists combine direct observation with family insight, they are more likely to identify meaningful targets and appropriate supports. Students should remember that observation is not passive. It is part of an active problem solving and instructional planning. The goal is to understand the child deeply enough that teaching decisions are purposeful, not generic. This careful beginning often saves time later because the intervention plan starts from the beginning with accurate functional information. Not every possible skill should become an intervention target, so choosing priorities is one of the most important decisions a team makes. A meaningful target skill should matter in the child's daily life and connect to what the family wants support with right now. It should also be teachable, which means the skill is specific enough to work on and not so broad that adults cannot tell what progress looks like. Another consideration is developmental readiness, because a skill that is far beyond the child's current abilities may create frustration for everyone involved. A strong target also has many chances for practice, since a skill that occurs only rarely will be harder to teach. For example, teaching a gesture for more during meals may provide more opportunities than targeting a behavior that happens only once a week. Meaningful targets are usually observable and measurable so that adults can see change rather than relying on subjective impressions. We have to practice asking 5 questions about every possible target, which are: does it matter? Is it functional? Is it within reach? Can it be practiced often? And can and how we measure it? When those answers are all yes, the team is more likely to select a target that leads to visible progress. Good target selection can set the stage for everything that follows in skill acquisition. Task analysis is the process of breaking a more complex skill into smaller, teachable parts. This strategy is especially useful when a child is not yet able to complete a routine or action from beginning to end. By looking at the skill step by step, adults can identify exactly where the child is succeeding and where additional support is needed. That prevents intervention from becoming too general because the team can focus on a specific part of performance instead of the whole task at once. Task analysis also helps with planning prompts, modeling, and reinforcement because each step can be taught intentionally. For example, if a child can grasp a cup but cannot coordinate the tilt and sip, the teaching plan can emphasize just that portion. Another advantage is that task analysis makes progress visible, since the child may master several steps before becoming fully independent with the complete routine. This visibility is encouraging for families because it shows that growth is happening even when the full skill has not yet emerged. We should remember that task analysis needs to stay practical and should reflect how the skill actually happens in real life. When used well, it turns a complex task into manageable learning opportunities. Prompting is one of the most common teaching tools in skill acquisition, but it must be used thoughtfully. A prompt is an additional support that increases the chance the child will respond successfully. Prompts can range from natural cues in the environment to gestures, models, verbal cues, and physical assistance. The key idea is that adults should provide enough support to create progress without giving more help than necessary. Too much prompting can reduce the child's chance to initiate, problem solve, or respond independently. Too little prompting, however, can lead to repeated frustration. This is why prompt hierarchies are helpful, because they help adults think systematically about how much support to provide and when to fade. Waiting is also part of good prompting, since many children need extra processing time before they can attempt a response. It's important that we avoid measuring progress only by whether the child completed the action, because the level of help matters too. The long-term goal is always greater independence, not permanent reliance on adult cues. Modeling gives the child a clear example of what to do, which can be especially helpful for motor, play, social, and communication skills. In early intervention, modeling should be simple, brief, and connected to a real purpose within the routine. An adult might model how to push a button for a toy, shake a rattle, wave goodbye, or use a gesture to request help. The model becomes more effective when the child is already engaged and able to attend to the adult's action. Imitation is then encouraged by creating an immediate opportunity for the child to try the same or a similar response. We should not assume imitation happens instantly, because some children need repeated exposure before they can attempt the action. Feedback should focus on reinforcing attempts and shaping growth rather than expecting a perfect copy every time. Modeling can also be paired with other strategies, such as environmental arrangement, prompting, and verbal expansion. It's important to remember that modeling is most powerful when it is purposeful and timed well, not when the adult repeatedly demonstrates without inviting interaction. When done effectively, modeling turns observation into action and supports skill acquisition in a natural way. Environmental arrangement is a powerful early intervention strategy because it changes the conditions around the child to make learning more likely. Sometimes a child does not perform a skill because the environment is poorly matched to their motor, sensory, or attentional needs. By adjusting space, positioning, access, and materials, adults can create better opportunities for progress without over-prompting. For example, placing a motivating object in view but not immediately accessible can encourage a gesture, a reach, or vocalization. Likewise, stabilizing a toy or improving seating may make it easier for the child to use both hands or maintain attention. Environmental arrangement also includes reducing barriers such as clutter, excessive noise, and too many choices presented at once. This is important because young children often show stronger performance when the task and setting are clearer and less overwhelming. We should think of the environment as part of instruction rather than a neutral background. When the environment is arranged well, the child may need fewer direct prompts because progress and success is already built into the setup. That is one reason that this strategy is efficient, respectful, and highly compatible with natural routines. Embedded instruction means that teaching occurs inside naturally occurring activities instead of separate drill sessions. This strategy is highly effective in early intervention because infants and toddlers learn best in contexts that are familiar, motivating, and repeated often. During play, meals, dressing, bath time, or transitions, adults can create many opportunities for the child to practice a target skill. The instruction may be brief, but the repetition across the day gives it power. Embedded teaching also supports generalization because the child is learning the skill in the same place where the skill is truly useful. Families are more likely to continue embedded strategies because they fit into the daily routines that are already in place rather than adding extra activities. The interventionist's job is to help identify those teachable moments and make the strategy manageable for the family. We should be careful not to confuse embedded instruction with random teaching, because it still requires planning and intentionality. The target skill, cue, support, and response to the child all need to be considered ahead of time. When done well, embedded instruction keeps intervention practical while still being systematic and effective. Repetition is necessary for skill acquisition, but not all repetition is equally useful. Infants and toddlers usually learn best when practice is distributed across many short opportunities rather than concentrated in one long teaching session. Distributed practice fits their developmental needs because attention, regulation, and motivation can change quickly. It also fits naturally with routines, since the same target can appear in different forms across meals, play, movement, and daily tasks. Repeated opportunities help strengthen the child's understanding, coordination, and confidence with a new response. However, repetition should still be meaningful because overly mechanical practice can reduce engagement and interfere with natural interaction. A good rule is to create many brief, successful attempts that feel connected to something the child wants or needs to do. We should always think in terms of practice opportunities rather than the length of an opportunity. This shift makes early intervention more realistic for families and better aligned with infant-toddler learning. Over time, these small, repeated moments create the cumulative effect that supports lasting skill growth. Reinforcement increases the likelihood that a behavior will happen again, which makes it highly relevant to skill acquisition. In early intervention, the most effective reinforcement is often natural and directly connected to what the child was trying to do. For example, if a child gestures toward a toy, receiving access to that toy is a natural outcome and strengthens the communicative attempt. Natural consequences are powerful because they make sense within the interaction and do not interrupt the flow of the routine. Praise and enthusiasm can also be helpful, especially when paired with the meaningful outcome the child was seeking. The goal is not to create artificial reward systems, but to ensure that successful attempts lead to worthwhile results. This principle helps children understand that their behavior has impact, which is especially important for communication and social engagement. We also need to remember to reinforce approximations when a child is still learning, because waiting for perfect performance may slow progress. As the child gains confidence, reinforcement can become more natural and less conspicuous while independence grows. Thoughtful reinforcement keeps learning motivating and increases the chance that a new skill will be used again. Shaping is a strategy in which adults reinforce behaviors that move progressively closer to the desired target skill. This approach is useful when the child cannot yet perform the full behavior, but is showing related attempts or partial responses. Rather than waiting for complete success, the adult notices growth along the way and responds to increasingly accurate approximations. For example, a child might first look toward a desired object, then reach, then vocalize, and eventually combine a clearer request with the reach. Each closer approximation becomes an important step in the learning process. Shaping helps maintain motivation because the child experiences progress and success while still being guided toward the more advanced response. It also encourages adults to pay close attention to the subtle changes instead of using an all or nothing view of progress. Always be careful to raise expectations gradually, because staying too long at an earlier approximation can stall growth. The adult's judgment matters here, since the child needs support that is achievable but still challenging. When used thoughtfully, shaping turns small attempts or approximations into a clear pathway toward more independent skill use. Chaining is used when a target skill includes multiple linked steps that occur in sequence. Instead of expecting the child to perform the entire routine independently at once, adults teach the sequence gradually. In forward chaining, the child learns the first step and the adult helps with the remaining steps until the later stages are added. In backward chaining, the adult supports most of the routine and the child completes the final step, which can be motivating because the child immediately experiences completion. Chaining can be helpful for simple self-help routines, play sequences, or classroom participation tasks that involve several parts. The best approach depends on the child's strengths, the routine, and what part of the routine is most meaningful or most motivating. As with other strategies, task analysis usually comes first so that the adult understands the sequence clearly. We have to remember that chaining is not necessary for every skill, but it can make multi-step routines much more teachable. It is especially useful when the child can do some parts successfully or independently, but becomes stuck in the middle or stuck at the beginning of a sequence. By organizing support step by step, chaining helps build independence in routines that might otherwise feel overwhelming to the child. Communication is a frequent and important focus of early intervention because it affects participation across nearly every routine. When children can express wants, needs, interests, and discomfort more effectively, frustration often decreases and interaction can improve. Communication targets should be broader than spoken words alone because infants and toddlers may communicate through eye gaze, body movement, gestures, facial expressions, vocalizations, or augmentative systems. Professionals need to honor these forms and build from them rather than waiting for speech before treating communication as valid. A strong communication plan creates natural opportunities for requesting, choosing, protesting, commenting, and sharing attention. Adults can then respond promptly so the child learns that communication has a clear impact on the environment and other people. Expansion is also useful because the adult can take the child's attempt and model a slightly more advanced form without shutting down the interaction. It's important to pay attention to function first, since a communication behavior is most meaningful when it helps the child do something important or meet a need or want. The functional emphasis keeps communication teaching practical and responsive rather than overly focused on isolated word production. As communication grows, many other skills, including social interaction and regulation, often become easier to support. Motor skill acquisition in early intervention should focus on helping the child move, access, and participate more effectively in their daily routines of life. A motor goal becomes more meaningful when it is linked to what the child wants to do, such as reaching a toy, moving toward their caregiver, or playing on the floor. Positioning is often a critical starting point because a child may need support for alignment, stability, or weight distribution to make successful movement possible. At the same time, positioning should allow active effort rather than keeping the child passive throughout the interaction. Motor teaching also benefits from repetition within motivating activities because children are more likely to attempt movement when there is a meaningful reason to do so. Students should avoid thinking of motor skill acquisition as completely separate from communication or play, because all of these domains often work together. For instance, a child may move more purposefully when trying to reach a desired object or to engage with a familiar adult. Observation helps the adults notice the smallest improvements, such as better trunk control, smoother transitions, or increased bilateral use. Those small changes matter because they often represent the building blocks for more complex participation. Effective motor teaching therefore combines developmental knowledge with functional, motivating opportunities for practice. Skill acquisition and early intervention also includes social emotional abilities and self-regulation. For infants and toddlers, social engagement and regulation strongly influence how available they are for learning in any developmental domain. A child who can shift attention, tolerate transitions, seek comfort, and re-engage with support is often better positioned to acquire other skills. Because of this, social emotional goals should be viewed as foundational and functional rather than secondary. Teaching in this area may include strengthening shared attention, turn taking, joint play, early emotional expression, and calming within routines. Adults often support these goals through predictable routines, co-regulation, warm responsiveness, and sensory-informed adjustments. It is important to remember that dysregulation is not simply non-compliance. The child may be communicating that they are overwhelmed, fatigued, uncertain, or have sensory discomfort. It's important that we think carefully about what the child's behavior may be telling us before we decide how to intervene or offer support. When adults support regulation effectively, they create a more stable platform for interaction, exploration, and learning. This makes social emotional skill acquisition central to high quality early intervention practices. Play is one of the richest contexts for early skill acquisition because it combines motivation, repetition, social interaction, and exploration. Within play, adults can target many different skills without making the learning experience feel artificial or overly controlled. A single toy or activity can support reaching, requesting, turn taking, problem solving, imitation, or movement, depending on how the adult structures the interaction. Play also allows the child to show preferences, which helps the adult choose more effective teaching opportunities. When adults follow the child's lead in play, they often gain stronger engagement and more authentic attempts at communication and action. At the same time, the adult can remain intentional by setting up opportunities, pausing, modeling, and responding to child attempts. Play is not a break from teaching because infants and toddlers rely on it as an ideal teaching context. We should always think about how any kind of materials, balls, containers, books, bubbles, and cause and effect toys can all be used to support target skills. Adults should not dominate the play. It should be used strategically while preserving the child's enjoyment and agency. When play remains meaningful and interactive, it becomes a valuable vehicle for learning. Children may struggle to acquire new skills when sensory input or regulation demands exceed what they can manage in the moment. This is why adults must pay attention not only to the target behavior, but also to the child's state during instruction. If the child is overwhelmed, distressed, fatigued, or unable to organize attention, teaching attempts may not be effective even when the strategy itself is sound. Adapting the environment can include reducing noise, adjusting lighting, simplifying materials, changing the pace, or altering how much touch and movement are involved. Predictability also supports regulation, so familiar routines and consistent adult responses can make skill practice feel safer and more manageable. These adjustments are not lowering expectations because they help create the conditions in which learning becomes possible. We should avoid assuming a lack of skill is always the same as lack of willingness or ability. Sometimes the immediate issue is access to regulation, and once that is supported, performance improves noticeably. This perspective helps adults respond more compassionately and more effectively to a child during intervention. Skill acquisition is strongest when teaching is matched not only to the task, but also to the child's sensory and emotional needs. Adaptations and assistive supports can be essential for skill acquisition because some children need more than instructional change alone to access learning. An adaptation may involve changing a material, object, position, cue, or response option so the child can participate more effectively. For example, stabilizing a toy may make activation easier, while object cues or simple visuals may support understanding and anticipation. Assistive supports should be seen as tools for access and participation rather than last resort options. When a support allows the child to engage, communicate, or move more successfully, it can open many additional teaching opportunities. The choice of adaptation should always connect to function, meaning it should help the child do something meaningful within a routine or interaction. Students should also remember that adults need coaching on how to use supports naturally and consistently because a helpful tool is only effective when it is implemented well. Good adaptations increase independence and participation rather than separating the child from others or making the routine feel unnatural. In some cases, a very small change in materials or setup can make a large difference in the child's ability to participate. Thinking creatively about access is therefore an important part of early intervention problem solving. Progress monitoring is necessary because teams need evidence about whether the child is actually learning the target skill. In early intervention, data collection should be simple enough to use in real routines and practical enough for families and providers to maintain. Useful data might include how often the child used the skill, how many opportunities occurred throughout the day, or how much prompting was needed. Descriptive notes can also be valuable, especially when they capture patterns about what has supported success or what created barriers. The goal of data is not paperwork for its own sake, but its goal toward better decision making. When adults look at data, they can tell whether to continue the strategy, increase the challenge, fade prompts, or even revise the entire plan. Data also helps make progress visible to families, which also helps strengthen their continued motivation and collaboration with the early intervention team. We always need to remember that measurable does not have to mean complicated, because even simple counts or brief routine-based notes can be meaningful. What matters most is that the data connects clearly to the target skill and helps answer whether the interventions are working. A good progress monitoring plan keeps teaching intentional and responsive instead of based on guesswork. Coaching caregivers is central to early intervention because most practice opportunities happen when interventionists are not present. Coaching is different from simply telling families what to do. It involves the modeling, joint problem solving, reflection, and confidence building. When caregivers understand why a strategy matters and how it fits a routine, they are more likely to use it meaningfully and consistently. If one adult says wait and another says prompt quickly, the family may not know which approach to use. Collaboration helps ensure that everyone is working toward the same target skill with similar expectations about support and progress. We should think of coaching as both instructional and relational because the family's trust and confidence affect whether the strategies toward skill acquisition are implemented. Reflection is an especially important coaching move because it helps the family notice what has worked and why. This helps build their capacity over time instead of making the family dependent on the constant direction from the interventionists. Strong collaboration supports the child's skill acquisition as well as the family's competence. When progress towards skill acquisition is slow, the first response should be analysis rather than blame or discouragement. Slow growth may mean the target skill is too broad, not meaningful enough, or not yet within the child's developmental reach. It also may mean that the child is not getting enough practice opportunities or that the current prompting and environmental supports are not well matched. Sometimes the issue is motivation, sensory load, health, family stress, or inconsistent implementation across different adults and the child's different environments. This is why progress monitoring and careful observation are important because they help the team identify where the plan is breaking down. It's important to avoid conclusions such as the child is stubborn or the family is not trying, because those assumptions can block effective problem solving. Instead, ask what conditions need to change for the child to access and use the skill more successfully. Even small adjustments, whether it's in the routine or the timing or the materials or a support level, can produce a noticeable difference. A strengths-based mindset is especially important here because it keeps the focus on problem solving and partnership. Slow progress should therefore be viewed as information that guides revision, not as evidence that an intervention has failed. This case can give us a chance to apply these concepts to a practical situation. So Maya is interested in toys and visually attends to them, which is an important strength because motivation and attention are already present. However, she rarely reaches and often disengages quickly, So the IFSP team needs to think carefully about access, positioning, and support. A first step would be observation of her body position, her endurance, visual engagement, and response to different toy placements and adult interaction styles. The target skill should stay specific and functional, such as reaching toward a motivating toy during floor play with less adult support over time. Environmental arrangement may include improved positioning, toy placement within a realistic but inviting distance, and reducing distractions in the nearby area. Prompting might begin with waiting, a gesture, or modeling before using more direct supports. It all depends on how Maya responds. Reinforcement would likely be natural because touching or activating the toy becomes the meaningful outcome. It's important to notice that this case is not solved by telling Maya to reach more, but by analyzing conditions that make reaching possible and worthwhile. This is the kind of reasoning that supports effective skill acquisition planning in early intervention. This toddler example highlights how communication skill acquisition can reduce frustration and improve participation in everyday routines. Eli already communicates by pulling adults, which means he is showing clear intent even though the form is limited. That existing behavior should be treated as a strength and a starting point rather than as something separate from communication. A meaningful target would help Eli request in a more understandable way during routines where motivation is high, such as snack time or playtime. Depending on his strengths, the IFSP team might support a gesture, an object cue, a picture exchange, sign, or even spoken approximation. Repeated opportunities could be built by offering small portions, brief pauses, choices, and access to favorite items that naturally invite a request. Prompting should be supportive, but not so fast that Eli loses the chance to initiate or attempt a new form of communication. Natural reinforcement is essential because the desired snack, toy, or activity should follow the communication attempt. We should also consider regulation because frustration may escalate when adults miss Eli's signals or the demands are too high for him. This can remind us that communication teaching often improves both skill acquisition and emotional regulation at the same time. As we learn more about early intervention, it's important to think critically about why a target skill matters, how a teaching choice can fit the child, and what makes a strategy workable for families. These questions are designed to help you synthesize the major ideas from this session and apply them to your real decision making. As you read and reflect, notice whether your thinking stays focused on routines, participation, relationships, and functional outcomes. If your answers sound too general, try connecting them to a specific child behavior or a routine-based example. That's a great habit because intervention planning becomes stronger when it is concrete, observable, and measurable. You can also find that different strategies seem most powerful depending on the child's strengths, regulation needs, and the overall priorities of the family. No single strategy works best for every child in every moment. It's important that your reasoning stays intentional, evidence-informed, and family-centered. These questions can help you identify what you understand well and what you still want to continue to practice as you work towards being an early intervention professional.